The Power of Mindset in Medical Profession by Dr. Andrew Iraniha. Patient Health Professional Experience Project, right? It was based on restoring the humanity back into our medicine, the compassion, connection, care, and kindness. And it was based on the idea that well-being of us, the health professional, is absolutely linked to patient experience. They feed from each other, they actually enhance one another. And the concept was based on the idea that every one of us has some innate goodness, and all we need to do is to cultivate that. And sometimes, especially when you're in a very tough environment, it's not that easy. So it requires work, a lot of work, personal development, personal work. And the Oasis for Humanity.com was created to support and promote this idea. And also was supposed to be a platform for all of health professionals to share their stories and ideas about this subject. So a few days ago, actually, I was at another hospital and a couple of nurses came to me and they said they just saw the website and they really enjoyed some of the material was in there. So after 1.5 years, seeing a couple of nurses from another hospital to see this was very refreshing for me. And I really appreciate if you can share the website with others, because it might help them for what they do. Now, going back to the personal growth and personal development, I'm going to talk to you today about the power of mindsets in medicine. Sir William Osler, the father of modern medicine, he once said in one of the quotes that medicine arose out of the primal sympathy of man with man, out of desire to help those in sorrow, need, and sickness. The relationship arises out of pain and suffering of one person and offer of hope by another. It's just so beautiful when you think about that. The way that he describes the medicine, it's all about who we are and what we are here to do. It talks about the primal sympathy, which is your compassion to others. And it talks about the desire, the intention, not as a job and work. It talks about not only people who are sick, but also people who are in need and sorrow, their family members, their loved ones. And it talks about relationship, that patient, health professional relationship, and it talks about hope, offering hope. It doesn't talk about offering medicine or surgery. It talks about offering hope. And in this picture, you can see exactly the definition of this relationship. And when you create that situation, when you look at medicine that way, then you can create something magical in people that you help. Something extraordinary that's sometimes even hard to put it in the words. You know, their smile, their sense of gratitude, the sense of understanding that it's in this hard world, that in this chaos, in this world that there's so much bad going on, somebody cares about me. And that creates a sense of contentment in the patient. And that's what I call patient experience. And when you create that in a patient, and when you feel that reward inside of you, then it makes you feel proud. It makes you feel alive, and it makes you feel content. And contentment is not always about happiness and smiling. It's feeling good about ourselves and who we are and what we do in this world. And when you do that, it's automatically you look for that feeling again to create that sensation of contentment. That's why it's linked with each other. So I'm going to ask any one of you, is that how you really feel about medicine right now? Is that how you feel every day when you come to work? You tell me. So we are a small group, but this is the place to be honest. In reality, is this how you feel?
That's why I got out of the acute care.
Yeah, you feel this way, right? Someday you feel this, overworked, really exhausted, confused, frustrated. It really affects your relationship. Too much pressure in the work. Too many patients, too much work to do. That's how you feel, right, every day? It affects your relationship between your colleague. And also, talk about shortage, and then frustration at the end of the day between your goodness and the pressure of work. And at the end, I see myself like this. This is how I feel. Look at their faces. You feel like you're a piece of a massive organization. And after a while, you feel like what you do doesn't matter. Even though every one of us has a very special and important function in this system, but that's not how we feel. We feel like a little piece in a big organization. And there's a mixture of feelings inside of us, right? Pressure, frustration, exhaustion. I love that picture. There's a lot of days that I feel that way. And it's not because I don't love my job, but it's just hard. And it translates at the end how we feel to the patient satisfaction. People feel it. And that's why there's a lot of talk about patient satisfaction right now. Because even the system feels that too, the dissatisfaction. And it's not going to stop, because as we go and the technology improves and our personal relationship goes down to the drain, then you will see that dissatisfaction more and more. It's just the nature of it. So how do we create that experience? You know, there's a lot of talk about how you create it. There's a lot of the studies and people that working on it, honestly working on it. The honest work to try to improve the patient's experience, because they know the importance of it. Not just financially, but from the human standpoint. But it can't be fake. It cannot be fake. And it cannot be with policies and procedures and dictating from the top. And for sure, it cannot have anything to do with creating beautiful, surveys, and that has nothing to do with that. It has to come from within. It has to come from us. So before I start talking about the mindset, I want to remind you about the picture that we had last time. You remembered about the stress and how when the experiences, the stimulus, the events that we encounter every day process in our brain. We sense them with our sensory system. Then we process that in our brain. But then at the end, the result is a perception. And that's the key. How we perceive things that happens around us, the events, the stimuli. And that perception, how we perceive that, is really related to our priorities, our experiences, our goals, our values, our beliefs. Those are the ones that dictate how you perceive the world outside of you. And remember this 10 way of coping with stress, right? And the top 2 was reframing your mindset and commanding your inner conversation. So I want to open up that a little bit for you and actually show you the scientific studies about the effect of the mindset, of what we do and how we perceive the world, and how we can actually manipulate that and towards our contentment. So what is the mindset? Everybody talks about mindset, right? Mindset, a state of mind. Mindset is actually a set of belief or a way of thinking that determine one's behavior, outlook, and mental attitude. So it's like a platform in our brain. So when a stimuli comes in and we sense them, and probably we sense them the same way, everybody senses them the same way, and it's processed, but then it processed on a platform in our brain, and that's the mindset. That's the one that end result would be the how we perceive the world and the stimuli that come to us. So there are a lot of work about, is this really something that we can change? And what is the effect of mindset? You've heard that mindset before, right? A lot of athletes, when they say, oh, I have a mindset of winning, I have a mindset of success, or somebody has a mindset of being positive. So things that he sees and encounter has a positive definition. Or somebody that is very negative, has a mindset of negative, and everything they complain when they see things. Everything is hard, right? But is it really true? Is that just a psychological thing, or is that really physiologic effect? So I'm going to show you a few studies that actually shows the change of mindset can change physiologically things inside your body. So Dr. Alia Crum came up with this study, and it was called Mind Over Milkshake, right? She talks about mindset, not just nutrients, determine ghrelin response. Ghrelin is a peptide coming from your stomach. And when you're hungry, if you're hungry, then your ghrelin increases. So it basically goes to your brain and make you seek food. You see, sometimes you're so hungry, you're going through, I go to the back door of the kitchen sometimes, and the door is locked, and then you gotta call the supervisor, and supervisor is busy, right? So that's what ghrelin does. It also decreases your metabolism. So it does two things, and it's called hunger game. hunger hormone. Not Hunger Games. That was a good movie. So, hunger hormone. So, and then when you eat the hamburger and the shake and everything else, then it goes down. It actually increases your metabolism, and then you don't want to eat anymore. Have you had that sensation when you eat too much? You say, oh, I can't stand it anymore, right? Other than Thanksgiving. So what she did is she called students for research and paid them $75 to come in and drink milkshake. Okay? The first group, they gave them called Sensi Shake. It was a fat-free, guilt-free shake. It's 104 calories. And they told them this and just say, drink it. And this is your $75 and go home. But before they went home, they test them for ghrelin. And the second group was the same people. They came back again another time, and then they had this indulgence shake. The milkshake was very yummy, and they said it's 620 calories, and that's what you're drinking. So what they did is they checked the ghrelin level at 20 minutes, 60 minutes, and 9 minutes. The 60 minutes is when they drank that, and the 20 to 60 was the anticipation of drinking that milkshake. And then you can see that the ghrelin level on the people who had indulgence ones, the ones that had high calorie, went down significantly. Right? That's what you expect. That's what we expect, right? That's what ghrelin does. It's a hunger hormone. When you drink a lot of calories, then it's supposed to come down. So that was right? But in reality, both of them, they had 300 calories. The shake was the same calorie. So you understand what happened? It's the mind. It's our mind. And what we do, you can determine actually changes in your physiologic things that happens in you. There's another study that she did with another Dr. Ellen Langer, who works on a lot of studies about the mindset. They talk about mindset matters, exercise, and the placebo effect. That was the title of the study. But what they did is that they worked on 84 housekeepers throughout the United States. So what they asked them first, whether they feel like they're doing any exercises every day. And most of them, they say, no, we don't do any exercises, we work. And then what they did is they put them into two groups. One group was a control group, and the second group, they gave them a flyer. They told them that in that flyer, that what you do, every movement that you do calories, and it's equal to exercising like 30 minutes on a treadmill. So that explanation was given to half of the people, and the other half they didn't. And this is what happened. They asked them afterwards whether they perceive whether they had exercises during the day or not. And you can see the group that they had that flyer, they were told that you get exercises. They had a perception of exercising. And then there was interesting thing was physiologic changes that happened to them. They had dropping a weight. Even the body mass index went down. The waist to hip ratio went down. And the systolic blood pressure went down. Just telling them about the benefit of exercise and what they do is equal with exercising, it created a physiologic changes, brought down the systolic blood pressure, and even they lost some weight. That's interesting, right? That's called mindset. Another doctor in Italy is Fabrizio Benedetti. He works on placebo and also this idea about mindset. And one of the research he did is he published it as pain as a reward, changing the meaning of pain from the negative to positive, coactivate opioid and cannabinoid systems in our body. So you know the opioid system in our body, right? The pain relief. So what he did is he actually created an arm ischemia for some patients, and they split them to two groups. The first group, they said, okay, well, we're going to put this and stop the blood circulation to your arm, and then we'll see how much you can tolerate the pain, for how long and how much. Okay? And the second group, they did the same thing, but instead they told them that when we do ischemia in your arm, actually it has a benefit for your muscles because they can tolerate the lack of oxygen, and then they grow and they get stronger and they get better. Right? And it was interesting that the second group that they were told that the ischemia is better for them, they could tolerate the pain much better and much longer. That's the power of mindset. He did another study on people who had thoracic surgery, which is very painful. The big, not the laparoscopy, the open surgery. And after surgery, he gave them, split them to two groups. One group, a physician or a nurse gave them pain medication, morphine, and told them this is a morphine we'll give you to decrease your pain. And the second group, they were connected to a machine that was given the same amount of morphine, but with no knowledge. So guess what happened? So of course, the ones that the physician gave them the medicine and they told them this is a pain medication and it's going to relieve your pain, the one that had expectation had much better pain response after this, which in reality is not supposed to happen, right? Because you're giving the same morphine, so it's not just the morphine, right? And we do that all the time. I've been doing that for the last 16 years in my practice, and people who work with me, they know that when I go to the room and they say this patient has a lot of pain, when you go there and explain to them about the discomfort and pain, and sometimes when it's normal and it's okay to have the pain, and you see the same people that they were complaining a lot of pain, then they have a relief of pain. So our mindset is very critical, and how we feel about things and stimuli and stresses that happen to us. And another last study is about rethinking stress, the role of mindset in determining the stress response. And this time they got more than 300 mid-level managers with a lot of stress in a big company, and they split them in three groups. One control group, and the second group was the group that they showed them a video. They sent them a video about the stress is really problematic for your health. The stress causing a lot of problem, it increases your blood pressure and so on and so on. And the second group, they sent them a video and talked about the stress is actually helpful. It improves your performance. It makes you be sharp and be attentive and have more attention to things, and it's going to improve your work performance. And guess what happened again? Right? So the group that they thought the stress was problematic had worse result as far as health symptoms. They had more headaches, more back pain, and they reported more trouble. And also they had less work performance, and the satisfaction from the work was much less compared to the group that had videos with the stress as enhancing and improving your work. Dr. Carol Dweck, she came up with this category of having fixed mindset versus growth mindset. So she says a lot of people, they have this idea that they can change their mindset. This is how they're born, and this is genetic, and we're going to be negative at all the time. And there are people that they don't feel that way. They think that their mindset, they can change it. They have the power to change their mindset in different situations and conditions. And those people, they have a growth mindset. So when they get to the time that they have challenges, people who have fixed mindset, they don't want to get into the challenges. And the other ones, they actually all embrace the challenges and they wanted to do it. When they come to the obstacles, they give up. The ones with the growth mindset, they don't give up and they persist on what they do. When it comes to the efforts, ones with the fixed mindset, they have this idea that, okay, it's useless, there's no point of doing it, and effort is fruitless. But the ones that they have a growth mindset, they have this idea that they have to work hard and this hardship and work effort that they do is part of the pathway towards the mastery. Okay? So the whole idea about this was the mindset is something that you can change. It's not genetic, of course. There are genetic factors involved. There are people more positive than others. There are people more negative than others. There are people who are feeling more, they have more mindset of success, and the stress for them is just a simple challenge towards reaching their goals. But some people, they can't tolerate it, and we know that. But overall, mindset is something that you can change, and that will make you a different person. If you be able to change your mindset, you can see the world in a different way. You can change your perspective towards the world. And it applies to everything. It applies to stress, things that you do at school, at work, even at home. When you change your mindset, things can be different. And it actually, as I said, you can feel that physiologically inside your body too. So it's not just a psychological effect that it has, it's physiologic too. Now, in medicine, that's the whole idea about when I say reframe your mindset. So for me, it's like a practice. Every day when I come to work, before I work, I review the reason I'm here. I change, I try to refresh my mindset. I try to tell myself that what I do is incredibly important. And you as a health professional need to understand that. Need to remind yourself this every day, that what you do is magical. You are here for a purpose, and the purpose is to give hope to people that are in sorrow and need and sick, and not just the people, their family members, their loved ones. And that's what we are here to do. And we have to understand this, we have to put it in our mind that what we do for them has the direct effect on us. It makes us feel better. And that's really an incredible link that we have to realize. So I put that in my mind every day. Even when I get frustrated, because you can't stop the frustration, you cannot stop the pain, and you cannot stop the stress of work. But when you sat down and pause and reframe your mindset again about what you do and how important your work is, then I can promise you, you feel a little bit better. Okay? And then when you face these challenges, before you go to the room of a patient, for example, and you know this patient and family are upset, if you reframe that in your mind right before you go to the room, I can tell you, it makes a massive difference. How you deal with them. All of a sudden, you're more compassionate. All of a sudden, you realize they're right. And then the way you respond is very different too. Try to practice that. And I can tell you, I promise you, it works. It works. So those challenges, daily challenges that you have, if you work it based on that mindset, that's the platform in your brain, then the perception is not a challenge. It's not a hardship. It's just a challenge to get to this. And you gotta, this is what you have to do. And again, I told you guys, don't say it loud because they're gonna say you're crazy, but say it into yourself. Talk to yourself. And I did that before, always during my lifetime. Every time I had to do a very difficult exam, I talked to myself. I gave myself hope. I gave myself energy before you go into it. It increased your attention. It increased your performance. It really worked. It actually improved your memory. I remember that I've done it so many times when I was doing exam. Okay, when I do go to work and I'm trying to do a surgery and it's difficult, I try to pause, I try to remember what I wanted to do and encourage myself. So you talk to yourself. That inner conversation is so critical and so important. And reminding yourself, it's not a joke. You know, some people say, some psychologists, this is really true, it's been proven that if you come in and sit down every day and write your goals, you have to write it. Now talk to yourself, write it, then it improves your life. And that's clear. I mean, it's been proven in every study, how you feel. So it's the same concept. It's changing your mindset, reminding yourself about things, and that really, really helps you at the end of the day. And also reminding yourself about the positivities that happen. And the positivities to me, when I come to work, other than what is my reward when I see my patients, when I do surgery and they feel good and they come to my office and I feel so powerful and proud when I see them, they feel good. Other than that, it's the relationship. It's really the relationship. And I tell you, this life worth nothing without the relationship. The human relationship that is really suffering right now, it requires us to revive it. And again, when you think about what's happening right now in this world, with all these technology and things that's going around, the improvements, but what is really suffering, the side effect of it, is our relationship. And we see that in the hospital, at home, with our family members and our kids. You see that lack of relationship, lack of that human experiences. And we are responsible to change that. We are responsible, every one of us responsible to change that. And when you do that, then if every one of us do that, if every one of us follow the same ideas and beliefs, then you can change the culture. Because what is the culture? The culture is a group of people with the same belief, a set of belief. That's the culture. We can change the culture in our hospital. So what makes me happy is if I'm coming here and see people, and that's the relationship we're talking about, right? And the end result would be something similar to this. That would be the end result. Thank you.